Hi, Professor Michael Terence. Today we have like special case, but I think the case seems like related to the joints. Can you have a look and tell me a little bit
Yes,
about?
hi Casey, it's nice to see you again.
Yeah.
Today we talk about a special psoriasis case. It's a case of psoriatic arthritis, but more interestingly, it's in a young boy.
Yeah, just only 10 years old.
Yeah, the boy is 10 years old. He's had psoriatic arthritis in his joints, obviously, for at least 5 years now. His parents have taken him to a few doctors already, to the hospital. They wanted to give him very strong drugs to take. Apparently, they wanted to put him on methotrexate, which can help the arthritis, but because he's small, and also his parents didn't want to start that at a very early age. So she came to see us with the son.
I see. Can you tell me like what's caused the triggers?
With a young boy like that, it's not always easy to know what started it, what's triggered it off. But we believe that he had a very bad infection, staphylococcal infection, where it lasted for at least nearly 18 months. He was treated for it, but we believe that like infection is one of the initiating triggers for psoriasis. So we believe it's the infection, but also he's now had a lot of problems with mental health because obviously his joints have swollen up, so he doesn't want to go to school. He's very upset. He can't play his sport. He enjoyed sport. Because with psoriatic arthritis, the joints become very, very swollen and very painful to touch. And also it's very hard for the patient to move the joints. So if they're playing sport, they can't catch properly. It's very difficult for them.
Even the adults, we are not able to suffering the pain like that, but he's just like 10 years old. But can you explain more, like before that, which treatment, the more that they give it to
they went to the doctor and he was given some, I think it was some steroids to take, but his parents didn't want to go on any stronger treatment. So he came to see us in the clinic. Now, in the clinic, we had to look at more, again, of an integrative approach where we look at the best medications he can have, both orthodox and also alternative, and at the same time look at triggers that we can manage with him. Like I said, he's been prone to having a lot of infections, and recently he had another infection. So we think the infection plus the emotional stress and mental health is not helping him. So with a boy, it's very difficult to get them to address stress. It's difficult to get them to comply with things because they don't want to do it. Especially a boy, because he wants to go out and play.
I got my boys the same.
So, but we did the best. Our doctors is very good with children, so we work with him and reinforce the positives as much as we can, that if he starts his treatment, he will get some improvement, and after a while, he will be able to go back and play with his friends at school. And of course, with the depression on top of that, he hasn't been attending school. He can't focus on the work at school. So the poor kid is missing out in many areas. You know, he's missing out in his social life, and he's also missing out in his schooling. But I'm very happy to see that after 2 months of our treatment, we gave him the treatment. We gave him special lotion to put on his skin, and also we gave him some herbal formulations to take, that he's been getting some improvement. It's not fully cleared up or cured. We can't say the word cured, by the way, but it's not resolved. And it can take, 5-6 months sometimes, but after 2 months, he's had some very good improvement. And I personally am very happy with it.
Me too. I can see that after 2 months, you get the result.
Exactly, and his parents are also very happy with it. And he's getting more confident also.
Of course,
I like to see him come out of his shell and start enjoying at school.
And he makes you happy as well.
Because that's what we work for, My life is to work to help the patients, whether they're this small or whether they're big. They're all patients, so they all need help.
I'm sure that they will remember you. So if the family had the boys or any member of family had the same condition like that, if they have the psoriasis related to the joints, so now they know which clinic they can come to have a look and look after them.
Yeah, we do our best to help them. Yeah, that's our motto is to do our best always.
It's great. This is important important experience for me as well because especially I got 3 boys.
Yeah.
Thank you.
It's a pleasure. Thank you.